Okay, so the mouth. The mouth has salivary glands in it. So there's three pairs of salivary glands. So there's some under our tongue, some at the back of our throat. What they're going to do is they're going to produce and release saliva or spit, okay, and it has some enzymes in it. So it's got lysozyme in it, so it'll break down pathogens, but it also has salivary amylase. Salivary amylase is going to start breaking down carbohydrates. Okay, now at the back of our mouth are our tonsils, and there's several pairs of tonsils. They're a lymphatic tissue, so they're going to protect us from ingesting pathogens. Okay, then the teeth. The teeth are going to mechanically break down food, so macerate the food. Okay, and then there's taste buds on our tongue. That's how we know how things taste. Okay, and the tongue also is going to help us break down the food, and it's going to move it to the back of our throat so we can swallow it. So the mass of chewed food is called a bolus. Okay, so the bolus is after you chew up your food and mix it with saliva, and you push it back to your throat, the back of your throat, so you can swallow it. Okay, so here's the mouth. This is pretty simple picture of it. The hard palate is towards the front of your mouth. Okay, the soft palate is towards the back. The thing that hangs down the back of your throat, that's called the uvula. Tonsils, there's some on the side. Those are pharyngeal tonsils. Okay, he's got the tongue lifted up. These are some holes for salivary glands. Molars, there's three pairs of molars in the back, and there's 2 pairs of premolars. Incisors are the 2 front teeth, and then the canine. Okay, so the incisors are for biting. Canines are for tearing. Premolars and molars are for macerating and chewing up the food. Okay, so teeth. So in adults, we have 32 teeth. We have 20 what they call deciduous teeth, which are baby teeth. So each tooth is made up of a crown and a root. So the crown is the part above the gum, and the root's what's below the gum. So there's a hard covering that's called enamel. So it's made up of calcium. It's on the surface. It's really, really hard. And then there's what's called dentin, and dentin is kind of like bone. And then the inside is pulp, the inner pulp area, and the pulp is where you're going to have nerves and blood vessels. So dental caries are also called cavities. Those occur when you have sugar on your teeth, and bacteria in your mouth break down the sugars. When they start breaking down the sugars, they produce acid, and the acid breaks down the enamel and the dentin, and it causes pain when actually it touches the nerves. So if you limit how much sugar you intake and how you should brush your teeth and floss your teeth, it reduces cavities. Fluoride also helps in children, fluoride helps make the enamel harder. Okay, so here's a picture of a tooth. Okay, so there's the enamel, the top part. There's the dentin. So that's the kind of like the bone-like part. Enamel's really hard. Okay, there's the pulp. Okay, so the pulp is like it's the blood vessels, the lymph vessels. Okay, so here's the jawbone. Then we have what's called here's the gum. Okay, and there's the periodontal membrane. And then under the lower part they call cementum. So that's what's actually going to help keep your tooth in your jaw. Okay, so periodontal disease would be inflammation of the gum and the periodontal membrane, so it can cause the tooth to get loose. Okay, now the pharynx and the esophagus. Okay, so the pharynx, they're calling it a cavity. It's kind of like a tube or a funnel, and it's between the mouth and the esophagus. Okay, it's going to take air to the trachea, to your windpipe, and it'll take food to the esophagus. So esophagus is this long muscular tube, and its job is to carry food to your stomach. Okay, so how do we swallow? So there's 2 phases. One is voluntary, so we're thinking about it. We take the food into the mouth, and it's going to go into the pharynx. So once the food's in the pharynx, swallowing is a reflex. So what's going to happen is the epiglottis, I'm going to show you that in a second, covers your larynx. So your larynx is your voice box. So like think of a guy and you can see their Adam's apple, because the Adam's apple is part of the voice box. So the epiglottis covers that, and it covers the opening to the trachea, so it makes sure that the food's going down to the esophagus and it's not going into your lungs. Then peristalsis is this rhythmic wave-like contraction of food. Okay, so it's almost like if you think about a snake that swallowed a big mouse, and how the mouse kind of goes down through the snake. It squeezes and it pushes, and it squeezes and it pushes. That's how food is going to move through our digestive tract. Okay, so here's a picture of how we swallow. Okay, so here's the bolus. So that's the chewed up food with the saliva. Okay, there's the bone, the hard palate, and here's the soft palate. Okay, so when we go to swallow, the soft palate's going to lift. When it lifts, it blocks off the passageway so our food doesn't come out our nose. Okay, soft palate comes up. Tongue pushes the food back. Okay, the larynx kind of rises up, and the epiglottis closes off the hole to the trachea. Okay, and we call that hole the glottis. Okay, so then the esophagus is open, and the food's just going to go down that pathway. Okay, and this shows how peristalsis works. So the circular muscles constrict, okay, and then the longitudinal muscles push. Okay, so we're going to squeeze the food all the way down the esophagus. Okay, gravity helps with that too. And then there's a sphincter. Okay, there's a round muscle before the stomach. Okay, and it relaxes, and then the food can enter. Okay, that sphincter closes so that the food can't come back up. Okay, so there is a health focus on page, what page is it? 174, about heartburn. Okay, so the stomach is really acidic. The stomach has a lot of hydrochloric acid in it. So what happens is heartburn occurs when acids that are in your stomach come back up through that sphincter and into the esophagus. So that's called acid reflux. Okay, so it can cause a burning sensation in your esophagus. Like if it's just every once in a while, like a Tums helps and it makes it go away. So a Tums is a base, and that counterbalances, it neutralizes the effects of the acid. Okay, now chronic heartburn is also called gastroesophageal reflux disease, or GERD. Okay, GERD can cause lots of problems because the acids can damage the esophagus. Can cause cancer. It could cause the esophagus to detach from the pharynx. It can cause all sorts of things. So there are medications that can treat that, but you can treat it with some easy things. So avoid high-fat meals. Okay, don't overeat. So if you eat a whole bunch of food, that's going to put pressure on your stomach and things will start coming up this way. Okay, so it's better to eat small meals, a bunch of small meals rather than 3 really big ones, and to exercise, like ride your bike, walk, stuff like that. That kind of will help control the weight and keep the food moving along. Okay, now the stomach. I'm going to stop here.